one of your top 5 preparation for appointment, list you should do is you got to be honest. And honesty includes how you are best being a partner in your care, particularly with lifestyle modifications, which are critical for PAD.
Absolutely critical to be very honest with what's going on, what your symptoms are, and what else is going on in your lifestyle. I have lots of patients who tell me, well, I tried to quit smoking. I said I quit, but actually I'm still sneaking a couple of cigarettes a day, but I didn't put that on the form. You are where you are. It is okay, but I need to know because it does impact how I recommend procedures and how we talk about the expected durability of procedures. If you have intermittent claudication and your leg is not threatened, even if you're telling me, I want to be able to go on these cruises, I want to be able to compete in my bowling league, but my leg pain hurts. If you're still smoking, it's going to be a very different conversation. I really don't offer interventions to patients who are actively smoking for claudication because the failure rate is so high and the risk of limb loss goes up. And it's a disservice to you to begin intervening when that part isn't controlled yet. But you've told me your why because you are prepared and you are training your doctor. So your why is, I need to compete in my bowling league. Great. Let's use that to help you quit smoking so that I can give you a safe intervention when it's time and when you're ready. But being honest is absolutely critical. And I'm not here to judge you. I'm not here to tell you what you can and cannot do. You are a grown-up. You get to make those decisions. But I do have to tell you what we can expect based on where you are today. And it's okay. But let's be honest with each other about where we are and where we're going to go.
Yep, that is so true. We just had a patient that had called into our Leg Saver hotline and they had had a bypass that failed. And it was literally within 2 weeks. And the first question I asked, well, do you smoke? Yes. You're still smoking? Yes. Well, there you go. And I know there are probably other factors because not everyone ends up, blocking back up that quickly. But in this person's case, yes. And so when a doctor says to you, I really need to know if you're smoking, they really need to know if you are smoking because it does 100% affect the durability and it's critical. And if you can wait to have a procedure until you stop smoking, that is, and Dr. Johnston, you would agree, that is the best course of
Yes,
action.
it is. Even 2 weeks of nicotine abstinence is important and helpful, even just in terms of your lung function, your ability to breathe well after surgery, not needing a breathing tube postoperatively or getting pneumonia. So even 2 weeks of abstinence is very helpful. And if you can wait, we should. Not everybody can. And in that patient who got a bypass, it may have been absolutely necessary. And knowing that they were still smoking would impact how I talked about risks and benefits. Right, the risk of that bypass occluding or going down, getting blocked off postoperatively is going to be much higher. And that's okay. We still have to do it, but we just have to be aware of what our risks are.
Yeah, and it gives the surgeon the opportunity that if you do have an acute situation, they do need to perform a procedure without question right then and there, that they're going to talk to you about not picking up that cigarette when you leave, especially if you have a wound that is not healing, because the oxygen can't hop on the school bus and be delivered to where that wound desperately needs that oxygen and other nutrients if you are continuing to smoke and all those chemicals are literally taking over your blood.
Yeah. And as a public service announcement, let me just say, I am asking everyone who can and is ready to think about that to stop smoking. Because I had a patient recently who came to me for a complication of a different procedure, but she had P.A.D. and her other procedure was related to her heart. And I asked her, she said, I don't understand why this complication happened. I did everything right. I did everything they told me. And she's still actively smoking. And I said, dear, but you didn't stop smoking, did you? Like, I'm sure somebody told you to quit smoking. And I said that with as much love and compassion and humor as I could, because she was open to that and clearly had that attitude about her. And she said, well, they told me it wasn't good for me. They didn't tell me I had to stop. Of course she knows
Yeah,
better, right? And we've talked about that and we
course.
laughed about that. But here is my announcement. Yes, it is bad for you, and you